It's normal for everyone to feel down or sad sometimes. These feelings can occur after having a bad day at work, having an argument with a loved one, or getting a bad grade on an exam. In most cases, these feelings don't last, and a person's mood improves within a few days. But a person with depression has symptoms that interfere with his or her daily life for at least 2 weeks. Depression is a common and serious mental disorder. It can affect people in different ways. It can change how a person feels, thinks, acts, and handles daily activities such as sleeping, eating, and working. People with depression may feel sad, hopeless, angry, irritable, and tired. They may have physical symptoms such as stomach aches, headaches, migraines, and muscle pains. They may have suicidal thoughts and suicide attempts. Only your doctor or a behavioral health professional can make a diagnosis of depression. If you've been experiencing some of these signs and symptoms for most of the day, nearly every day, for at least 2 weeks, you may be suffering from depression and should talk to your doctor. Persistent, sad, anxious, or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy or fatigue, moving or talking more slowly, feeling restless or having trouble sitting still, difficulty concentrating, remembering, or making decisions, difficulty sleeping, early morning awakening, or oversleeping, appetite and/or weight changes, aches or pains, headaches, cramps, or digestive problems without a clear physical cause or that don't ease with treatment, and thoughts of death or suicide attempts. Not everyone who is depressed experiences each of these symptoms. Some people experience only a few indicators, while others may experience many. Several persistent symptoms, in addition to low mood, are required for a diagnosis of major depression. But even people with only a few but distressing signs of depression may still benefit from treatment. The severity and frequency of symptoms and how long they last will vary, depending on the person. Depression, if left untreated, can lead to thoughts of suicide. If you or a loved one is having suicidal thoughts, call the toll-free National Suicide Prevention Lifeline, anytime, day or night. Depression is one of the most common mental disorders in the U.S. Current research suggests that depression is caused by a combination of genetic, biological, environmental, and psychological factors. Risk factors include a personal or family history of depression, major life changes, trauma, or stress, as well as certain physical illnesses and medications. Depression can happen at any age, but often begins in adulthood. Depression is now recognized as occurring in children and adolescents, although it sometimes presents with more prominent irritability than low mood. Depression, especially in midlife or older adults, can occur with other serious medical illnesses, such as diabetes, cancer, heart disease, and Parkinson's disease. These conditions are often worse when depression is present. Sometimes medications taken for these physical illnesses may cause side effects that contribute to depression. A doctor experienced in treating these complicated illnesses can help work out the best treatment strategy. Depression, even the most severe cases, can be treated. The earlier the treatment can begin, the more effective it is. Depression is usually treated with medications, psychotherapy, or a combination of the two. No two people are affected the same way by depression, and there is no one-size-fits-all for treatment. It may take some trial and error to find the treatment that works best for you. To learn more about treatment options for depression, talk to your doctor or a mental health professional. Several types of psychotherapy or talk therapy can help people with depression. One type, called cognitive behavioral therapy, can help individuals with depression change negative thinking. Cognitive behavioral therapy can help you interpret your environment and interactions in a positive, realistic way. It can also help you recognize things that may be contributing to the depression and help you change behaviors that may be making the depression worse. Computerized cognitive behavioral therapy, or CCBT, is based on the principles of cognitive behavioral therapy. These educational, interactive, self-help modules can assist you in learning to identify your own patterns of thoughts, feelings, and behaviors. They're designed to help you understand how your thoughts shape how you feel and how they impact your life in significant ways. This program offers a number of different computerized cognitive behavioral therapy modules that may be helpful to you. In the next section, you may review the available modules and select the one that you feel is the best fit for you. Each module includes 5 sessions that you will complete over a period of 1 month. Between sessions, you will have an assignment to work on each week. Remember, any new skills take time to develop. The time you spend is an investment in you and your quality of life.